At each annual public meeting, the district takes the opportunity to hear from people who are at the coalface of the organisation and the work that they do. This year is no exception, with our volunteers being put in the spotlight. To help us get an understanding of the great work our volunteers do for the district and local communities and of course our patients and consumers, please welcome Catherine Lee and Jenny Francis.
Hi everybody, my name's Catherine. I'm the Goulburn Health Service Volunteer Coordinator, and I've been in the position for 2 years. I oversee volunteers at Goulburn Base Hospital, Community Health Centre and Bourke Street Health Service also. Now this is my very first time speaking in an annual public meeting, so the nerves are slightly up there, so let's get to it. First of all, I'd like to acknowledge the traditional owners of the land and pay my respects to elders past and present, and I welcome any Aboriginal people here today. So has anybody got any hand hygiene products in their bag? No? Good, we won't need it. You do? Oh, thank you very much. Look, you can keep it because I actually want to give you an infection today. I want to infect you with something. And it is volunteering, of course. So you're not going to leave this room without coming and seeing me, and I assure you it won't be a contagious infection, merely one of body, mind and spirit. Okay, so our volunteers are very, very good at doing hand hygiene in all our facilities. Let's have a snapshot around the district. We have approximately 600 volunteers across the district, approximately 20 different types of programs that we run around our district, and that equates to at least a minimum of 4,500 hours volunteered each year. So there's people not getting paid. I can see our lovely volunteers sitting at the table over here. That equates to a minimum of $127,845 that the health has received in value in kind and that we haven't had to pay out. So who are our volunteers? There's actually a lot of people here that volunteer maybe for different organisations and from health. In our services, we have ex-bank managers, accountants, a lot of ex-nurses, grandparents, parents, students, and we're always on the lookout for any other type of person that wants to volunteer. So my last spot there is actually reserved for you because I can talk a leg off an iron pot, so I may be coming and chatting to some of you later on. Okay, so around our local health district, we run many programs. Now these programs are based on our models of care and they're designed to complement what our wonderful healthcare staff do when they deliver patient care within our local facilities. So here we have Leanne on the left, the nurse unit manager of the subacute rehab unit in Goulburn, and she's sitting with one of our volunteers, Ted, who's in the dementia delirium program and also does my emergency toiletries clothing in the base hospital. And we've just received a donation of new products there. So these are for patients that may be in vehicle accidents that come through, maybe there's homeless, maybe they're escaping domestic violence, lots of different reasons that people don't have access to these vital products that provide good patient care and dignity and honour. So some of our volunteers work across 2 and 3 programs, and we couldn't do it without them. We couldn't manage all the programs without them. So here we have on the right the big tall fella. That's Mike. He's my right arm is his other name. He's our volunteer committee president, also my palliative care home visiting and oncology clinic roster team leader, and an all-round good guy. He's standing with Sister Maria Assunta, who also volunteers in pastoral care and our Chit Chat program across many of the hospitals. She specifically works in the Marion unit at Bourke Street Service in Goulburn and comes in on the weekend, does some communion for patients, but also spends a lot of time talking with those patients that are socially isolated or just on for a good chat. On the right is Kay. Kay crossed over from the dementia delirium program, has now become my key person for activity packs in the hospital. This came about from a demand from patients and from staff talking with us that patients were sometimes a little bit bored, particularly those that weren't in an acute state but were in a longer term rehab and they needed more things to do. We also want to particularly cater for patients' individual needs. This is about our patient-centred care. So we have created activity packs. So we have copyrighted Sudoku puzzles, crossword puzzles. Our local Goulburn Post paper supports us in a lot of that. Those people that I hassle to get copyright, if they don't agree, they send me books to keep me quiet. And we have a lot of pencils, coloured pencils. Bunnings, our local Bunnings donates the coloured pencils, and our volunteers fundraise for the money to purchase the pencils, the highlighters and the sharpeners that goes in those packs. So these are distributed mainly through subacute rehab unit and our renal dialysis unit for people that are in there 5 and 6 hours actually on dialysis, giving them something to do. Okay. So when you volunteer with Southern New South Wales Local Health, you can expect to get training and education, ongoing support, camaraderie and friendship, to learn new skills and to be challenged. Of course, we also like to have fun. And here's Tom, one of our patient transport drivers and used to work in oncology clinic when the specialists come, and that was at our previous Christmas party. This year, we attended the Goulburn Volunteer Expo, the photo down the bottom right, and we had a lot of combination of our volunteers from Melissa's team at Patient Transport, our Dementia Delirium or hospital volunteers that wear the yellow shirts, and our general volunteers across many different programs. So I promised that I wouldn't take too long, and I am going to hand over to my colleague, Jenny Francis, but I hope that I've infected you somehow with nothing too horrible but very contagious. Thank you so much.
My name's Jenny. I'm the volunteer coordinator at South East Regional Hospital and Pambula Hospital. And I just wanted to start off with volunteers are an integral part of life at South East Regional Hospital and Pambula Hospital. We have over 80 volunteers assisting in many areas of the hospital, relieving the pressure on staff by keeping patients entertained with different activities or just by having a chat with their families. Our hospital volunteer program has been designed to provide information and learning to enable a volunteer to support people with dementia and delirium in the hospital setting. And the volunteers assist patients with drinking, completion of menus, ensure they're wearing their glasses and hearing aids. They also support them with different types of activities. Our subacute rehabilitation unit is to provide restorative and rehabilitation services and to promote independence in activities of daily living. The volunteers are actually called, we've got a breakfast club. They assist with setting up the breakfast area and dining area and then cleaning and tidying up that area once the patients have had their breakfast. Our next volunteer program is our Pink Ladies. Now the Pink Ladies / gentlemen is to assist patient comfort and care during their stay in the hospital. They provide cheerful company and conversation. They arrange and take care of flowers. They collect and distribute newspapers and magazines, and they also wash and dry the patient's clothing on request. Our pastoral care volunteers provide an emotional and spiritual support in times of suffering and crisis. Our oncology volunteers support their families and carers, and this requires the volunteer to be an unobtrusive presence who listens to their concerns, fears and needs without judging or giving advice. The volunteers offer drinks, and they also insist on making the patients feel comfortable, and they also support the doctors and nurses on clinical days. And our next program is our physiotherapy. Now the physiotherapy program is held at South East Regional Hospital and also at Pambula Community Health. And that program enables clients who have completed formal group therapy programs to continue their established exercise programs. This allows the patients or the participants to maintain their level of function and prevent avoidable hospital admissions. We have our, like I've already mentioned, we have our falls and balance programs at South East Regional Hospital and Pambula Community. And that's well supported with our volunteers, and they actually run the maintenance programs when they finish their programs. Now, the next volunteer program we have is our emergency department. We have a new volunteer that's coming on next week, and that volunteer will be supporting the emergency department, the patients, their families and carers while they stay within the emergency department area and also in bays inside the hospital. So that's going to be really important when we get that up and running, and that volunteer has an EN background, so that's very beneficial. Our mental health inpatient unit. That volunteer program aims to promote recovery, which is an integral part of a consumer's recovery, and it's also to maintain links with the wider community. And we have our volunteer coordinator, and he is a music and art teacher, and he's providing musical therapy programs. The children's ward, the primary role of volunteers to provide a pleasant, safe and welcoming environment for children and their families, and also to support the families that they need to have respite or leave the unit, then the volunteers there to support the families. Our renal volunteers provide support and companionship to people undergoing their treatment, and they interact with the patients, they spend time with them and engage in activities. They support the services with the nurses to restock patient packs, and they also support the nurses with any administrational duties that may be required. And I just wanted to say that we are very fortunate to be supported by a generous and committed community. So hopefully I didn't rush too quickly, but I knew I only had 5 minutes. So and I just wanted to quickly say that I do have, an information booth up the back, and I did bring along our programs and our application packs if anyone's interested in taking it. Thank you.
Thank you so much. That's fabulous. And I think when we're talking about volunteers, it would be remiss of us not to also mention the Ladies Auxiliary who are here with us today. So in a different kind of voluntary capacity, and who I actually gave money to laugh at my jokes today. Thank you.